I'm going to be talking about nutritional strategies to improve your brain health and also the importance of a positive mindset. I feel that both are equally important. Here's a fun fact. It would take about 100 million laptops to equal the processing power of the human brain. I feel all this processing power, it is very important to provide your brain with the proper hardware and software. So by that I mean the proper nutrition and also the proper mindset, positive thinking patterns, rest and relaxation. All this processing power is going to demand energy. So as the most complex tissue in the human body, the brain is also the most oxygen demanding. The brain also uses up to 30% of the body's glucose supply, even though proportionately it is much smaller. So the cells of the brain are known as neurons, and they're the key players that transmit information and form networks, allowing our consciousness, our skills, our thoughts, our function. So these neurons, they demand a constant and rich supply of three things. So can anyone guess, or does anyone know what those three things are? Exactly. So glucose, oxygen, that's going to make ATP.
Right.
And there's one more thing, stimulation.
Ah.
What is one of the most effective ways to test for these nutrients? By that I mean glucose and oxygen. Anyone?
Blood.
Yes, blood chemistry exam test.
Mm-hmm.
So, and I feel using the functional ranges. So for those of you that aren't familiar with what functional means in terms of blood chemistry, think of a stoplight, right? So we have green, yellow, and red. So if a lab value falls in the green area, it's all good, you can go, right? Your value is normal, you're healthy. If a lab value is in the red, then that's a problem. That's a significant, that could be a disease, you need some treatment, you've got to slow down, stop, and take a look at things. But there's also this yellow value, and I feel as like a natural healthcare provider, say like a chiropractor, nutritionist, a naturopath, a holistic MD, so we feel that yellow value is very significant, and proper nutritional support can help prevent that from becoming red. And that yellow area may even be related to some symptoms you're having, or even and your brain health. So a lot of times, unfortunately, in traditional healthcare, whether it's insurance reimbursement, etc., that yellow area is overlooked. So examples of that, right? So what would some examples of that be? So like a lower high fasting blood glucose, hemoglobin A1C, cholesterol, a low LDH, indicating glucose metabolism problems in your body and your brain. And then for oxygen, it'd be things like anemia, B12 folate, or iron, indicating poor oxygen. So we all have that relative, or we know that person, that they didn't really live the ideal healthy lifestyle, but they lived to be 90 or 100 just fine. So I think when George Burns, he comes to my mind, right? In every picture I see him in, he's holding a cigar. So I would bet that these people, they were always doing things. They were always keeping active, learning new things, having new experiences. So the human brain has plasticity. So I don't mean, by plasticity, I don't mean plastic, like for kids' toys. I mean plasticity in that the brain can form an immense network in the brain cells that is always changing. So allowing us to take on new skills and functions and thoughts, which forms our memories and personality. So as we get older, however, our brain cells are constantly dying off, right? But as we get older, we're developing more plasticity, right? Which keeps our brain functioning even better. So I guess to explain this, think of like a 3-year-old kid and let's say like a 60, 50-year-old adult. So the 3-year-old, they have more brain cells, but the adult has more plasticity, more connections. So therefore the adult has better things like better balance, better coordination, and better verbal communication. But can you think of a factor that keeps this plasticity to continue to develop well into our 60s, 70s, 80s, and even beyond?
We're talking food
New
products?
skills.
I was just
Don't say fish oils.
no, I was just
Use it or lose it.
yeah, stimulation,
Oh.
right? So stimulation develops that plasticity that we need later on in life. Well, I'll always do. If you find learning new things to be much more difficult than before, or things that you have always been doing to be getting more difficult, you may need to ramp up your brain stimulation, right? So by that I mean things like reading a novel, taking on a new hobby, maybe engaging in a new sport. And then you may also need to look into the basics like optimal glucose and oxygen to supply the brain, as well as things like fatty acids, oxidative stress, and maybe your gut health. All these things are connected. So I heard a really good quote on a podcast. If you lose the mental game, you lose the physical one. So negative thinking patterns, they can be a major detriment to our health. I think we often forget just how important a positive mindset can be. So how many people have heard of blue zones? Is anyone? Excellent. So there are about five communities throughout the world, and they're known for their longevity. And most of the people live to be a 90 or 100. And some of the communities, they're very almost dementia free. Some examples are Okinawa, Japan, Sardinia, Italy, and even right here in California, Loma Linda.
Yeah.
Yeah, that's where I went to pharmacy school. So besides, besides excluding processed food, they're all very active within their families and their communities. So they all engage in their communities, they know everybody in their community. Although that community is very isolated, whether religious or geographical, they're all very connected. So does this connection maintain healthy brain stimulation? I think so. So now I want to go into a little more detail about optimizing your mood. So when brain energy is compromised, the brain can break down, so to speak, and lead to poor mood. According to Dr. Karazian, all neurodegenerative diseases, so that includes things like Alzheimer's and Parkinson's, they all start with depression. So when one has chronic low mood or depression, their frontal cortex has decreased activity or neuronal firing. So for those of you that don't know, the frontal cortex is this front part of our brain right here, and it kind of distinguishes us as human. It gives us our higher level thinking, our consciousness, our personality. So the key to help someone overcome their depression is to find the mechanism that is causing that decreased firing in the frontal cortex. You want to ask, what are the other symptoms that accompany that person's depression? So do they have depression with fatigue, depression with brain fog, depression with anxiety, depression with vertigo? These symptoms can help key in on the mechanism that is contributing or even causing the depression. So I don't want to forget to talk about memory. So again, constructive stimulation is very important for the brain to maintain plasticity in order to maintain a sharp memory. And of course, healthy and consistent amounts of glucose and oxygen to fuel the neurons to maintain plasticity. There are 4 main neurotransmitters used in the brain: serotonin, dopamine, GABA, and acetylcholine. Does anyone know which one is involved in forming memories? So it's acetylcholine. So this is the essential neurotransmitter for concentration, brain endurance, and memory. So it is responsible for converting short-term memories into long-term memories in the region of the brain known as the hippocampus. So this would include visual, spatial, and verbal memories. So then symptoms of acetylcholine impairment would be things like getting lost very easily, poor memory because you can't form pictures in your mind to recall, and poor verbal recall, and maybe difficulty calculating numbers. So early signs of acetylcholine impairment, so like too many senior moments, it should not be taken lightly, but addressed right away. So this includes addressing the basics like optimal glucose and oxygen. For those of you that don't know, many researchers are now calling Alzheimer's disease type 3 diabetes. So because they're finding that the predominant abnormality of Alzheimer's is decreased glucose usage by the brain cells. So it's just like a type 2 diabetic, they can't utilize the glucose throughout their body. Same thing going on in the brain in Alzheimer's. You can't get in there, glucose can't get in, and there's lack of energy and the cells continue to decline. So additionally, you want to look into things like, are there adequate fats in the diet? Very low fat diets, maybe junk food vegetarians or vegans, may be too low in essential fats such as choline, which the body converts into acetylcholine for memory. And then of course, chronic stress and lack of sleep. These can be damaging to the area of the brain known as the hippocampus, which remember does what?
Serve memories.
Yeah. Converts short-term memories into long-term memories using acetylcholine. So the stress and these things, stress and lack of sleep, may contribute to dementia as well.
Wow.
And then there's some supplements that can be great for boosting memory and may even help prevent or delay Alzheimer's. Some of my favorite are alpha-glycerylphosphocholine, L-husperazine A, pantothenic acid, and acetyl-L-carnitine. So as far as optimizing memory, never forget to inquire about medications. So as a pharmacist, I'm not anti-medication. However, I'm all too aware of some of the side effects of these drugs, which can include poor memory and dementia-like symptoms. So some examples would be anti-anxiety drugs, antidepressants, cholesterol-lowering medications, antihistamines, incontinence drugs, and opioid painkillers even. So please note, I'm not telling anybody that it's okay to stop your medication without getting permission or consulting with your doctor first. But I feel that it's very important people are made aware of these things before starting the medication or looking to preserve their brain function into their golden years. So I'm almost done, so I just wanted to give a plug for the supplement company Apex Energetics. I get a lot of my material from this talk came from them, and they do a great job at educating practitioners. There's a lot of great supplement companies out there. This is the one I'm kind of familiar with, I like. And then also, I'd recommend for anyone wanting to get to know more about like brain health and nutrition and functional medicine and nutrition, I really recommend the book, Why Isn't My Brain Working by Dr. Tatis Karazian. And so it goes really in depth into what I've been saying, and it's a great read for those of you into that kind of stuff. So it's time to wrap it up.
Thank you so much.
Oh, no problem. You guys are welcome.
Awesome.
Thanks.